was the killer.
Yeah.
So now it's, I think there's less snoring and the volume's better.
Wow.
Okay, if it's, and you know, if you, when you're at a point where you can actually, tell, then that's usually significant. Yeah.
So you wake up feeling a little bit better.
Do you,
I'm
do you,
not
do,
waking
do,
myself up, cause I actually do wake myself up, sometimes you get big,
Yeah.
But she stays awake, I go right back to sleep.
Sorry.
Or she goes to the other room. Like I said, it was a perfect, I thought the perfect thing to test this whole, system out is because, like I said, I can't convince myself not to snore, or to snore quietly, so. Very interesting, I thought.
Yeah, good test.
Oh, yeah, it's interesting.
Very cool.
All right, stop taking it, I'll go back to my snoring.
Is that for you again? Yeah, okay.
see, so what you're gonna, I think that's very interesting, and, it'd be good to see how that continues on. See, so these are the kind of benefits from, and the bottle says, what did the bottle say, how much you're supposed to take?
I'm just looking at the package.
Yeah, take a look at that, that's,
Says, paddles, let 3 pellets dissolve in our tongue 3 times a day and reduce intake with improvement or as directed by healthcare practitioner. So are you taking it just before bed, or are you taking it?
I take it 3 times a day, so, 2 tablets, so after my morning coffee, somewhere after supper and before bed.
It does not induce drowsiness?
Not that, no.
no, I wouldn't do that,
Okay.
it wouldn't do that, I don't think.
Ain't got good mom, there's no flavor or taste, that you get a little bit of a sugar taste and that's it, so,
Mm-hmm,
that's it.
very good
It's not like a
experience.
pill, you try to swallow it down, it doesn't go down, it's like, oh my, that tastes awful.
Oh, yeah, yeah. Like Buckley's?
Yeah, it works.
I like Buckley's.
Hello. So we're gonna try to do, you said, okay, so you said you had some tendonitis, so you don't wanna take 2 remedies at the same time. That's another thing you usually don't do. It's better when you do homeopathy, you want to stick to, when you do these combinations, then you're looking for, but you know what, your remedy actually had cuprum in it. Did you feel any improvement in any of your, you said you had tendonitis in your elbow?
Well, it's been raining lately, so I haven't been doing my watering in the garden and stuff like, so different work right now or chores around the house, so,
So you haven't been, okay. So
Right.
that's when you're gonna be able to tell.
yeah. But like you're saying, there's something in there that would,
May.
may help.
So the way, when you find a good remedy, okay, so a constitutional remedy is taking all the symptoms into account. So when you take the remedy that you need, it helps you heal in all domains. It peels that layer, and it's the full layer. And so you improve in a number of areas that you see are having trouble with, because they're all connected, it's like a picture, but not for acutes. So if it's like you bumped your head, your long-term knee pain is not going to go away, right? But if you take, so similarly, if you, for your chronic condition, all things that have been there for a while, they should all kind of improve. But you're taking a combination. So in that combination, you're looking at one specific organ, and you're trying to solve that. So that usually means just that, and you don't do a combination here and a combination from another at the same time.
So it said if I
Why
wanted
can't you
to,
do that? I'm just-
Because the homeopathics you're taking them orally, and they're working in the entire system. So they're trying to reset your system in working better for a particular. All these combinations are working in one organ, and so they're directing energy towards that area and trying to help it heal. When you send another set of remedies, then it's going to try to direct you somewhere else. So it confuses the. I mean, it's not that you can't, you could, but it's very hard to figure out what's happening now. It's not a methodical approach. It's not like it'll cause you harm or anything like that. It's more
So
like,
he's takes his anti-sleeping thing, and then he should be taking say develops a sore throat or whatever, then he should be taking anything for that.
So you would stop one. Yeah.
In a homeopathic form.
Now, if I knew I had to boost one of the 3 or 4, ingredients is on top of it, is that flame of fire? So, I can't remember what it says in it.
Belladonna was one of the things in there.
So if I took just one of them and plus this mixture,
Like, tell me, what do you say, what do you mean?
okay, so there's 3 ingredients in
Mhm.
the pill I'm taking. If there was one item I thought that
Let's
is
say belladonna.
belladonna will help with my arm or something breathing, could I take a booster of that and keep doing the combination?
So like he's saying, like the composition has the 3 things in it at a 3 CH, and he add in a 30 CH of one of those ingredients on top of what he's doing without wonking things out too much.
I don't know. Yeah, seriously, it's you. So I'm methodical in my treatment approach, and I try to solve things at chronic cases. I don't work as a practitioner who does combinations. I'm sure there might be a system, but we would be experimenting together. I don't have the right answer for you. And actually all of medicine is actually like that. You know, we're all, practitioners are in practice. We're practicing and we learn from our practice and we see how that is. So you would be your, N=1 trial, the 1 rat trial. I do a lot of 1 rat trials. I'm the rat. So definitely, yeah, we do trials and we learn from that. So you document it and you see how that goes. But in terms of classical homeopathy, the way we know homeopathy to be beneficial is through tried and tested methods that we look at in the books called, what do we call the books?
Medical?
Materia Medica.
Material.
Yep, yep.
Trying to remember without
Yeah.
cheating.
Yeah.
So were you gonna offer a remedy for tinnitus, like ear ringing? Is that what you were?
Oh, tinnitus? No, I think he said tendinitis, right? Yeah.
I have both, but yeah.
Yeah. Oh, you have tinnitus?
Oh, no, tennis elbow and golfer's elbow.
Oh, okay. Yeah, tinnitus is something else. It's the ringing in the ears.
Right.
No, what I'll do is I will give you cases. I'll be the case and give you like mock examples so you can try to solve them. And you can look through your notes and we'll see how prepared we are with the acute homeopathic remedies. And yes, so I would recommend if you do combinations, you pick up this. I'm glad you did that, like you did a trial. Then you document what you've seen and then you that's how you will get experience with homeopathy. And I would also recommend seeing if you can go off slowly to see what is the minimum dose that you can use for the so like, let's say you're doing 3 times a day right now, go to once a day, then go 1 to every 3 days, then once a week. Somewhere down you're like, oh, my snoring is back. You're like, oh, okay, let me increase it. It's always good to intervene minimally. Minimum intervention is a good is beneficial for the body to do its own work. We want that. I believe in that. The minimum intervention, minimalist intervention, especially for invasive things. Homeopathy is very gentle, but like minimum surgery, minimum drugs, yeah.
So is homeopathy more, or like it is for the physical parts of sickness?
Is homeopathy more for the?
More for the physical as opposed to like the,
Emotional sense.
yeah.
It's for both.
Yeah?
Yeah, for
Okay,
sure.
okay.
Yeah, because if you look at the remedies that we were discussed last time,
Uh-huh.
we said person wants to be left alone, right?
Okay.
Person wants to be, what else did we say? They feel scared. They feel
Like isolated?
isolated,
Okay.
right? They don't want to move. These are feelings,
Yeah.
right?
Yeah,
Right?
remember that.
So then the other remedies that we'll cover, you'll see that the thing we did cover. Did we cover anxiety? Yeah, they were anxious. That's a feeling, right? As a state of mind also. So mental emotional remedies, yes, they all have mental emotional components to them. Yeah.
If you're taking a remedy for an extended period of time, would you
Mhm.
have to wean yourself off of it, or could you just stop completely?
If you're taking for anything you want to wean yourself off
Okay,
in general. If you see benefit from it,
yes,
then you want to go slow.
okay,
But this is not him. I'm not telling him to wean himself off.
right.
I'm telling him to find the minimum dosage. There's a difference between.
Difference, yeah.
Yeah. So let's say he finds the minimum dose is once a week. He could stay on once a week for a long time.
But would the body go through a withdrawal if you just stopped taking what you were taking?
Homeopathics, no.
No? Okay, that's what I wanted to
What
know.
Yeah.
about dependency?
Same kind of thing, right? Homeopathy is not like that
Okay.
because the homeopathic is not what's doing anything. It's your own body. It's a little pellet that doesn't have any molecules in it, right? It's a signal for the body. The body is doing it itself. Signal's not there, body won't do it. And the best thing is that when the body does it, starts doing it itself. It picks up. So you guys have that handout we have from last time?
Do you have an extra copy?
I do have one copy.
Okay. Sorry, I forgot.
Oh, sorry. It's good to take notes around it and. Yeah. So does anyone have any questions? Questions are really good. So did you have any questions from our previous lectures? Anything that you are confused about in the remedies we're covering? Because we're basically for the rest of the time, we're just gonna be talking about remedies, and we're gonna try to of course discuss things as with the clinical skills that I have. I'll be giving you guys my clinical insight. But do you have any questions from the previous lecture? Because in the previous lecture we talked about remedies. We've already talked about how to use them. We've talked about how to use the materia medicas. We've talked about what is repertorizing. Who can remember what is repertorizing? To repertorize something, using the repertory. Go ahead.
It's categorizing the symptoms.
Who categorizes them?
Like there are the books, so like the research has stated that these are what
Yeah.
The greater than, less than, all those things in my head, like the symbols as far as, these are the more important complaints, chief complaints.
Yep, chief complaints, very good. And greater than, less than is more about makes aggravated from and ameliorated from, worse and better from. Yep. Okay. And those are categorized by doctors over years, practices who have shown the effect of the remedy through something called a proving, yeah. So we're gonna continue on with different symptoms and different acute problems. And what does acute mean? Acute problem is something different than a chronic problem. Sudden, small, short duration that's happened, right? Which is combination remedies are useful in those regard. So I'm going to give you some of the old symptoms that you can tell me a little bit about them. If a person comes in, we covered last time, because the last 30 minutes or so we were just covering these remedies. If a person has a break in the arm, a fracture, what kind of remedies would come to mind? Yeah? Symphytum is one of them. Anybody else remember anything else? Ledum? Yep. What can ledum also be used for? Bites from little critters. Puncture wounds, yep. Yes, very good. And what about our favorite arnica? Right? Because arnica is specifically for bones? Muscle. It's for tissue and tissue damage. So it's helping in general. The ledum is for the congestion in the area. Right?
So now would you have all three at once? Or
You could.
combination, or-
Yep, we mentioned that you could take them all as once in a combination.
Would they be all combined like into, I was gonna say one pellet, or would they be a separate pellet?
That's exactly what so when you combine it, you could have 3 different pellets,
Okay, okay.
right? And you could, you could take them all together, and then companies, however, they mix them all together and put them in one pellet.
Gotcha.
Like what he's taking for his snoring.
That's a combination, like Don, right?
Yes.
Don's doing for his snoring, that's a combination. So the fracture that you're using arnica for the injury, ledum for the congestion because it's not moving, and symphytum for the bone healing would be a combination that you could go to the store, pick up all 3, and take all 3 together. For example.
Your arm being in the cast still, broken?
Yeah, you're just taking orally.
Okay.
Yeah, you're or you can get your friend to go pick him up for you.
No.
Yeah, it doesn't mean like you have to move. It doesn't mean that you're just taking it orally. Yeah.
No, that's what I'm asking, like, will your arm still be in that cast?
Yeah, you're in the cast. You just broke your arm.
Yep.
Say, go pick up these. Like I one time I was in a different life. I different life. Yeah, I used to teach a kids class in Taekwondo. So one time I was teaching the class, and I did a reverse turning kick. And I felt something in my back, and I sit down. Then I lie down, and I was like, okay, class is over. You guys take a break. So they all went home, and then I called my wife, and I said, just go get these following things from my kit. And then they sent it over. I was lying there. She gave me the stuff. I did a little acupuncture. I was able to get up. So yeah, sending people for remedied runs is very common once you're familiar with the homeopathic pharmacy.
This Nux vomica.
Yep.
On the outside, you haven't spoken about it yet.
Next one, okay, yes. We haven't got there yet, but yeah.
No, so is that something somebody that's abusing drugs and alcohol?
Actually, sometimes Nux vomica is given for people with a hangover.
I see that, but then it says abuse of alcohol, drugs, or smoking and food. So that's what I'm asking, is it something to be giving somebody that's addicted to that stuff?
Does it treat the after effects?
Okay, let's see where that is. Where is that right now?
Right above the table.
Huh?
It's on the left-hand side.
Under the sun.
Oh, okay. Oh, there it is. Okay, I'm gonna get there. I'm gonna get there. Let's go. We're going clockwise right now, and then we'll come up, and then we'll get to that stuff too. So from the last class, I had mentioned a few things. Trying to see if you can remember. What about okay, so a strain and in the eyes, or a injury to ligaments and tendons? What would be a good remedy for that? Yeah, ruta. Yeah, yeah, ruta. I don't know how you pronounce it. The Canadians say ruta, right? We say Toronto. Well, we don't say Toronto, right? I don't know. People tell me you have a very Canadian accent, and I was like, really? What? I can't even pinpoint it. What is so Canadian? I guess it's our tea or something. I don't know.
About, that's a big word for Canadians, about, Americans just laugh when we say that word.
Yeah, but what is I can't hear the difference.
I don't know either, but that sounds funny to them.
So that's
How
that.
do they say it, or?
I don't know.
I have a lot of cousins.
Well, I said they actually said that to me. So the way you said about, and I was like, well, how do you say it? And they said about, and I was like, do we? Is that how we say it?
No, I don't know,
Yeah. So ruta is it has a stiffness, and it helps because the connective tissue is stiff. It can help with a lot of connective tissue problems. What about insect bites and bee stings? Red, hot, swollen, itchy, painful. Apis. Yeah, there's another one too that we covered already. Lead very good. Good. So it's good it's good you have the notes, but also see if you can get, the more we talk about it, the more familiar you're gonna get. So we ended with Cantharis, I think, and that was our last remedy, right? And I said it's for all burning sensations. It's made from a beetle, and now we're going to be talking about the.
That was for internal though, right?
Yeah, right. So far, we're talking about taking the homeopathics internally, even if you had the sensation could be external. So you could have a urinary tract infection that feels like it's burning, or you could have a burn on your skin. You still take the homeopathic internally. You could actually take the dilution of a homeopathic remedy and pour it on as well. You could, but I'm not sure how effective it would be, because we're looking to use your own body's internal vital force to come to it. But I do know that people have done that. In our clinics, we use these small vials that we inject into syringes, and then we inject them into the body superficially. So that's an interesting approach. People do, like, this world of homeopathy is still relatively new. It's only about 200 years old. So we're still learning a lot about it that we, it's like it's like the cutting edge, literally the cutting edge of medicine. Medicine is not even here yet. Like, if you tell people you're taking a homeopathic course, they're going to say, oh my God, that stuff doesn't work. Most people do not understand this. Yeah.
Are they still finding new
Usages?
remedies or
Yes, they are. Oh yeah. There's a world of people who's now, let's do a proving on it. Like the most random thing is that let's, because not everything's been discovered yet, even, right? Right. Some type of rare fish in the depths of the ocean. They're gonna wonder what the energy is like. Yeah.
I see. I get
Yeah.
it. Okay, cool.
Very cool. Very cool.
Been a guinea pig?
I have. I'm actually, I said, I'm my own rat in my own experiments all the time.
So then do you publish your results?
So these are called N=1 trials, right? Like it's one rat experiment trials, and people publish them all the time. I have not published my work. I my life has been a little bit, like, I'm actually here right now doing this more for fun, because I just want to get back into a few things of teaching that I really value. But as I said, I've been overseas for 20 years. I've been since 2004. I left, and I was exploring lots of things and writing my. I don't know if I mentioned, like, I'm an author. I wrote a book, not about this, but so I was busy in my life doing a few other things. So other than clinical practice, I haven't done much to contribute to the field. Yeah, which everyone should, like, as a doctor, one of our callings, one of the oaths you take is this: the doctor is a teacher. And so I really do believe in it, and I take my oath actually very, very seriously. I do believe in you have to empower people and teach. So doctors are very engaged in research and putting these things together. And there's conferences, and I go to those too. But in the industry, in the field, no, I have not published anything significant. I did do a trial once on, I think I was telling you, on dolphin's milk, right? But that was more for fun for the class too. I still have the research on my computer. Could
You said
publish
on
that.
dolphins?
What was that?
You said on dolphins?
Yeah, dolphin's milk.
Oh, yes, I remember you said.
Remember that?
Yeah.
Yeah.
Very cool.
All right. So we're gonna continue on. Let's go down to now calendula, hypericum, urtica urens, belladonna. All right. Now they're putting this as the remedies for burns. We talked about cantharis. Then it has calendula and hypericum and urtica urens. That is urtica urens is stinging nettle. You know stinging nettle?
Yeah.
And do you see the little mark beside it, like a circle with a line through it? You know what that means? This one.
Usually means nothing.
It's in the language of medicine. This is referred to as the mother tincture. So whenever you see this means mother tincture. This is the before the homeopathic preparation.
So that's what you would use instead of a homeopathic tincture?
So it's just showing that if you have a burn, then you can use the mother tincture, because we know calendula, as Don probably knows, calendula and hypericum and urtica urens, they're actually good for the skin. So you could use them to help your condition. But the homeopathics are also useful in that sense, because they are good for burns and burning sensations. Urtica urens, like stinging nettle, you hit it on your skin. Who knows stinging nettle? You ever had touched it?
I was in Scotland last summer with my son.
Yeah.
And we were walking the trail because my son has ADHD. We were trying to burn him out that first day. And he backed himself into like a
Bunch of-
bush. And he was going on. And I'm not big on pharmaceuticals. I'm not against it either. My uncle says to me, "Oh, there's dock leaf." I'm like, "What's dock leaf?" Like, we don't have that here. I guess it's sort of similar to what jewel leaf would be here, but
Okay.
different families.
Okay.
He just crushed it and rubbed it right on the spot. Instant
Relief.
Yeah. It was-
So what's that herb? Dock leaf?
Dock leaf, yeah. It's in Scotland.
Yellow dock. Oh, I think probably it's yellow dock.
Maybe.
Yeah. Is it or curly dock? Is it like a long, thin,
Yeah.
curly type of leaf?
Yeah, it is.
Yeah. We have it here. It's all over the place.
Yeah, it was.
And if you crush it, it has a kind of yellow color.
Yep.
Yeah. It's called yellow dock or curly dock. We have it everywhere. It's native to this place.
I didn't know that. That's
Yeah.
awesome.
And you can. That's what. Who's this? Is uncle of yours?
My uncle, yeah.
Yeah.
In Scotland, he's a fisherman, so he.
They know all that stuff.
Yeah.
It's great, and that's how you use things. Yeah. And so then you can. There's a lot of herbs like this that you can use.
Yeah, it worked great. We ended up getting like a calamine ointment
Yeah.
just in case,
Mhm.
and when we put it on, he complained that burned, so we went right back to the dock leaf.
Yep.
Yeah.
Yep. Great.
Says, the curly dock is Rumex crispus.
That's right, Rumex crispus. You're gonna see it right now too. We're gonna be talking about it probably. Maybe not here. Okay. All right. Rumex crispus. That's right. That's the Latin name. We know the herbs through their Latin names usually. Curly dock or yellow dock is so next classes our next module is going to be on herbs and supplements, and I'm gonna maybe I'll touch one day on botanicals. Otherwise, we'll do some mechanism of action of supplements.
Are
Yes?
you at all able to like touch on how to make some sort of like salads and things like that?
We could do that. Sure.
Like, I don't, everybody has like touched on that a little bit, like, but like how to do the bases and things and just,
Yeah, we could do that. Sure. I could. It's open.
also just, I think
Yeah.
you're interested in that sort of stuff. That's-
Okay. Okay. I can think of
I
things
just know
with
there's
that.
a lot of people who sell like, tallow,
Yeah,
different tallows,
yeah,
and
yeah.
they sell a calendula based like, bombs and things
Mm-hmm.
like that.
Lip balms and
Just-
things. Yeah. Mm. Those classes are really fun when you actually make it.
Mhm.
Yeah. Okay, so now let's go to, so these rendering calendula, hypericum, urtica urns, belladonna. So belladonna is also for, basically for inflammation, red, hot, inflamed areas. Cantharis, we explained last time, is also for that. Hypericum is more for a nerve type pain, and urtica urns is it's stinging nettle. So that's the Latin name, urtica urns. So these are good for sunburn. You can use them as a mother tincture, but because they have, you can see they're for that red hot type of pain. Then after that, we're going to be talking about joint injuries. So we're back to two remedies. One is ruta. Again, that's for, what do we know about ruta?
Eye strain,
What was that?
eye strain,
It could be. Why does, but think of it,
like tendons
yeah, think of it more for connective tissue problems. So the eye strain is happening because the tissues in the eyes are not relaxed, and you're not being able to focus focus the eye because of its problem in the tissue. So similarly, in your small joints, wrist pain, ankle pain, it can be used. These remedies can be used for twisting the ankle, but they have there's a particular sign to it. When you feels better by movement. Okay, so if you have a red hot joint, your ankle's swollen, red and hot, you don't want to move it, and you're like, oh look, I saw on this paper it says ruta or rustock, and I twisted my ankle, so I should use that for my red hot swollen ankle. Should I use rustock for that? Why not?
She said it needs to be moved.
It what?
He said it was to be used when you wanna move it.
When moving it up, limbers it up.
So that's roost tox?
Rustox. Rustox is poison ivy.
So
Right.
movement feels better?
Movement better by movement. Yeah.
Is
And
rust
is rust tox.
tox?
And ruta also is improved by movement. Do you understand? So this is not the acute phase in the sense that you just injured it. When you just injured it, you could use arnica. After a certain point, you're like, oh man, it's always stiff. And after I limber up a little bit, then my joint feels better. Then you're like, oh, that's a ruta problem. That's a rust tox problem.
So the difference between the two of those is you had rust tox was swollen and red
Nope.
versus.
No, when it's swollen and red, we're talking about the other remedies, Cantharis or Ledum or Arnica. What you would do is, before you use any of these, right, you would have to, even on Google, you could say, homeopathic remedies for ankle pain, right? And then it'll come up, you'll start seeing, oh, I know arnica, oh, that looks for like the immediate injury. Rust talk, it's more for when it's past the energy, the problem, but you have inflammation, it's remaining.
older.
Oh, yeah, a little bit older, yeah. Yep. That's also for low back pain, How many people, right? When how many guys, when one wakes up in the morning, oh, I feel, right? And then you're like, oh, just a little bit of movement, huh? And you move around, you get yourself limbered up, take a nice hot shower, and you suddenly feel good. That's rust tox. Okay. Again, it's visiting the Leadham remedy, and it's talking about puncture wounds. We covered that out. This is going to be a little bit easier to get through this because we already covered some of this. So, Leadham for a puncture wound. Okay, and then, oh, very interesting, silica, right? We covered that. It's very good for splinters. And you know how people have been stung by a jellyfish? You go to somewhere, you take silica, and it'll help push out. It helps the body push out substances that are in the body, like lodged into it. So it'll help the body get them, expel them.
So you don't pee on it?
Oh, that's probably some other remedy. I don't know. I've heard that.
So would it help with the sting, bee sting? Would it help with that?
If the stinger is still there,
Yeah.
it could, but the stinger's going to be there. You can pull it out, but it's going to get swollen. So it would be better as an apis remedy or remedy for, like Leadham or something. Silica is basically, when you get the splinter in there and it's stuck in there, inside, it's deep inside, you can't get it out, you need some tweezers or something like that, and it's stinging. Silica could help with that. It'll push it out. But they say you should be careful with the silica remedy if you take a high dose and you have like like people have heart, things inside. What was that?
Pacemaker?
A pacemaker or some type of a device that's lodged into the body, and then you don't want to increase the body's like rejection of it. You don't want to. So you don't want to take high doses of silica. We were talking very light doses. What was that?
That makes sense.
Yeah, it's a remedy that's making the body very robust and strong and pushing out.
So if you had, say, bolts in your leg.
Yeah, you don't take heavy doses of silica.
Okay,
Yeah, and we're not talking about heavy doses anywhere. We're talking about
Right.
light doses. But you can understand, we're to understand the systems of how these remedies are working, right? So it's pushing things out, clearing things out, helping your body to absorb through digestion, making your body more hot instead of cold. All right. Again, it's mentioning it's showing an injury on the foot, arnica and Leadham. All right. Then this remedy I've never used myself. Pulex irritans. It's saying for fleas. I can look it up. And again, because I don't do a lot of work with animals or. I do a little bit, but not more for our own animals. But I have never used this.
What about, like, bigger animals or smaller?
We have like different animals on the farm. So we have
Okay, I
like
see.
goats and goats and chickens and things like that. So those are
Cows?
smaller. We did have a cow, but I never used a homeopathic for it.
Oh, I see, okay.
Yeah, but for the goat, we had this little baby goat that was born very frail and very weak. And sometimes it happens when the goat has lots of, like gives birth to more than a couple.
Mm-hmm.
And so then this gave birth to 4. So we gave it silica to strengthen it, to try and started nursing more, and
Oh, I see.
made it stronger. Yeah. Okay, so then let's move up to chamomile. This is a chamomilla. This is a very good remedy, and it's in my experience it's showing a crying child. So this remedy definitely should always be, I think, should be in your medicine cabinet. Very useful, especially if you deal with like young kids. I used to deal with a lot of young babies and young kids. We'll take a break and just give me 5 more minutes so we can. I want to make sure we get through all these. So it's a very hypersensitive child. It's also chamomile is it's a flower, sensitive flower. So they're angry, they're irritable, they love to be carried, and they're inconsolable. It's like I don't know if anyone has had kids, but there's nothing you can do to calm them down, and you always have to carry them. If you sit down for a second, they're gonna start crying again. They are so sensitive to pain. There's an aggravation happening at night, sometimes even in the early mornings. During the day, they might be a little bit kind of okay. One cheek oftentimes is very red, right? And it's so sometimes it's because they're teething, right? And so this could be a very good teething remedy. Their ear pain sometimes happens, so those are kids that have got like an ear infection, a toothache. They'll have some diarrhea sometimes, oftentimes because of the pain, and their stool comes out in a green color. They have that here? Or they're just saying colic? Yeah, yeah. Stool like cut grass or spinach. See as well. That just says it in bold. Yeah. So it's like a green color stool. Can anyone relate to this? Yeah. Okay. So I think I've given all our kids chamomile at some point or another. So this is one of those remedies for that crying baby. Chamomile.
We sell lots of it for
Yeah.
everything.
You do. You saw a lot of it, right?
Yeah.
Yeah. It's such a common remedy.
So can you use that on adult ear infections?
If they're acting like that. Sometimes us men
That's
do.
amazing.
We tend to have a lot of pain. You know, we like to be in bed and babied a little bit.
Yeah.
Well, no, if
just
somebody
a
has an
little.
ear infection, is there something else you would?
See, it has to match. Is the reason I'm telling these odd symptoms is because these are, although they're common symptoms, but sometimes the child won't react like that. They could be they could have an ear infection, but they're not irritable. Their cheek is not red, but they're actually very limp and they're very cold. And so it's a completely different remedy. So if you gave that homeopathic remedy and it didn't match, then you're not doing like cures like. Do you understand? The like picture is a picture that matches, and all the symptoms get covered from it. See? So if it's your husband, he's usually calm and collected, but right now he's just I can't be bothered right now, it's right, and he's half his face is red. He's like super sensitive. He doesn't know whether or not to stand up or sit down or lie down or kick the sheets off or then you're in a kind of a chamomile picture, and you could try, and he's got like soft stools that are not digesting food properly. But I haven't seen many men with this picture.
Oh, I was saying,
Right.
man, I'm just saying adults.
Yeah, but I'm just saying that like they're showing the babies because certain remedies are very well, like there's a certain picture that's common with like a child, for example. So as you get older, you become more complicated, and there's a lot more. Like right now, we're covering maybe like 10, 15 remedies that are just really common, so they come with pictures. Okay, so then we'll go to we'll now come with next one. Now, Nux vomica. This is also called columbrina. That's another word for it. Columbrina. C-O-L. So Nux vomica is a very interesting remedy. I've used it many times in my practice. This is made from also a poisonous plant. I think it is. I think it is. Is it the? Maybe you can check. Someone who can check what Nux vomica is made of. It's not. I think it's a poisonous plant. Is it from
STRY,
Strictus?
stricken tree, also known as Nux vomica, poison fruit.
Okay.
Creeper button, deciduous tree native India, Southeast Asia.
Yeah. Yes, and they used it. They used to use it for like on arrows or something like that. So this Nux vomica is basically, this remedy affects the liver. That's why we have the little blurbit that says it is good for a hangover. The reason is because the liver is the organ of detox. It helps to take out toxins from the body. And in our general lifestyle in the western part of the world, 'cause Easterners, when I was living there, they're more chill there, you know, things in life is moving a little slower. You know, people are more family and, you know.
So it'd be good for someone with fatty liver?
So it could be used for anybody with a type A personality who is high strung and all pent up. Because when you're all pent up and you're all go, 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 you're not detoxing, right? The body is in a state of either sympathetic and running and moving around, or it's in a relaxed state. Nux vomica patients are not in a relaxed state. And that can happen. What they do, it builds up their toxicity in their body. And sometimes they're oftentimes very irritable, because when you haven't detoxed well, then your irritation becomes high because you have toxicity in the body floating around that you haven't released. So the liver, the liver produces bile that takes toxins from the body, it puts them into the gallbladder then puts it in the colon, and if you have soluble fiber in your colon, then it'll excrete it in your stool. If not, then it gets reabsorbed. So because if the liver is not dumping properly into the colon, then you now have toxicity in your body. So the Nux vomica helps to ease the liver's function. This is a very unique function in natural medicine that Western medicine doesn't have. There's things called choleretics. Have you heard of choleretic? Choleretic is something that makes the bile move. So Nux vomica, all things that help the liver become better help the bile move, choleretics. So Nux vomica could be, you can see it as like a choleretic. It helps to.
So it helps someone that didn't have a gallbladder?
What do you mean it helps?
Well, you're saying that it goes from the liver into the gallbladder until, so if the gallbladder's missing, the liver's working that much harder.
The liver's, okay, so here's these are all, I love questions, this way you'll understand more and more. Homeopathic remedies can only do what the body's capable of. So if you're missing the gallbladder, nothing can replace an organ. That's why it's always better to keep the tonsils, keep the gallbladder, keep whatever you can, right? Because if you use natural remedies and you can bring those organs back to their full function or somewhat function, it's always better than removing them. If you've removed it, you're always going to be compensating. So the remedy will never be able to bring that function back. However, it could ease the symptoms a little bit. So the liver, those who have no gallbladder, their digestive strength will never be the same. And if their liver, is having a problem, then the symptoms have to match. So the matching symptom is someone who's very high strung, type A personality, duty bound. I must do this because it's my, I must get this project out because, I'm a responsible worker who is going to get the promotion at the end of the year, and this is going to be my, right? And they're going to make her all their, and then
Somebody that's still employed full-time at the age of 70?
it can be anybody. Well, what's it called? I've given this remedy to stay-at-home moms, but they're
Okay.
just they're driving the kids here, and then after that they're gonna make their appointment. Then after that they gotta cook, and then after that they gotta busy all day, and same thing happens. You get into a state of go, and it's not relaxed, and then they'll have symptoms of toxicity and irritability. And so that's similar to when someone has drunk too much, their liver is stagnated. It's similar to also when someone takes some drugs or something that their body's trying to relieve. It's built up. So the Nux vomica will help to relieve that.
And it says, it was extracted from the seeds and were historically used to create poison arrows and darts for hunting and warfare.
It does, right?
Just saying.
Yeah, exactly.
Very cool.
Yeah, totally. Every remedy has a particular job and interesting energy about it you want to discover through the remedies.
Awesome.
Yeah, and many of them, and many times it's explored through dreams. This world of medicine is I consider it like a sacred art, and people who in the past who didn't have all this access to research and at the molecular level and everything, they discovered things through dreams. And you'll read that Native Indians and also people from different parts of the world who had a connection with, they were spiritually very like good people, and cared to practice their profession and to help people, right? They were sincere. Then they would see dreams, and the plants would come to them and say, use me for so and so, I'm good for so and so, and they would, and this is, discoveries have been made that way, and I believe that this is from God. He's giving spiritual insight into these things. Other people, like the Native Indians, they would see animals when they're sick. They'll go and they'll eat something, and then they'll vomit, and to feel better. And so then we knew that these plants were used for to induce vomiting, or so. All this stuff is, once it's documented, then you gain more and more information. It's a very fascinating field, and so homeopathic is just the next deeper level of that. It's like seeing the energy of it, and that can also appear in dream form as well. All right, this is another great remedy: carbo veg. Carbo veg.
Yeah, we talked about it a little bit.
Yeah.
Poisoning.
Food poisoning.
It's okay, so it can be used for that, yeah. But it's in a. So you said food poisoning? Who said that?
He said,
I did.
Bad fish.
Bad fish.
Okay, yeah, but again, it has to have a certain state, and that state is that you're in a very debilitated state, on the verge of collapsing. So you're just like, you're apathetic, and you're cold, and you're averse to being cold, but you want to be fanned. You have a it's called air hunger. Air hunger. So you're trying to breathe, and you need more air, and you want to be fanned, and you want to be in the open air, but you feel cold too. And you feel there's indigestion and bloating. You're weak, incapacitated. If you pass gas or you pass a burp, it feels better. Feels stuck. And this is like something that you can even feel. Your heart is feeling a little bit weak. It's weakness in general. You're like almost in a collapse state.
Is this like a description of lightheadedness, or is that like?
You can say kind of lightheaded, but it's lightheaded with weakness, with bloatedness. It's a picture. It's a complete picture here.
or fainting.
Yep, fainting. Yep. Someone who's almost fainted, or you have your little homeopathic kit handy. Pop in a carbo veg. Oh, it can also happen because it's actually showing it from the sun, right? So someone who's got sunstroke. Yeah, so they also have heat stroke there with belladonna, glanoin, and antimonium crudum. That's for heat stroke. So let's do those three, and then we'll give everyone a break for a few minutes. I'll try to end in a few minutes early. So if you have any questions, then we can take them on homeopathy before everything ends here. So see, heat stroke is you get really hot, right? And you can get into the state. So this is a very different state. Someone who has heat stroke is feeling very hot. Very hot. They're not sweating. They're feeling inflamed. Their head is hot, but their limbs are cold. That's a belladonna picture. Someone who got heat stroke, but now they're completely exhausted. They're like, on the ground. They're feeling, their pulse is very light. It's a carbo veg.
Sorry, what were those sentences again?
So the carbo veg is completely exhausted, wants to air, can't breathe, just bloated, completely, down, and that could have happened because they got, from the heat from the earth, or sunstroke or something. But that's different than the belladonna picture, which is a very hot person who's hot in the head and inflamed and can't move, and because their limbs are cold, but they're having like an inflamed hot sensation in the head. Carbo vision doesn't have that hot sensation. They have a collapse sensation. One has collapse is the biggest thing. The other one is heat is the biggest thing. The other patient, a heat stroke patient, antimonium crudum. This is the person who's very quiet, soft, sensitive, irritable, but they're also hot and aggravated by the heat. So they're not, and it's not just sun heat. It could be even radiant heat. The stove is too hot. The fire is too hot. The heater is too hot.
So they're grumpy.
There is an irritability for sure. They call it all things. They're peevish.
Isn't that peevish?
Yeah, it's a peeve. They're irritable with everything. They don't want to be touched. As you can see, this could be applicable to the heat stroke, right? They have also indigestion, a weak digestion. They could feel nausea, burping. Same thing, very similar to carbo-veg, but carbo-veg is more air hunger. And this is really just not so bothered by the heat, very irritable. This is more irritable. Carbo-veg, a lot of air hunger. Belladonna, very hot. The heat is and blood is moving. All having the heat stroke. So see, in Western medicine, it's like this one particular medicine. You give it, it's an anti-inflammatory, brings inflammation down. Just trying to use it for everybody, not helping the body to heal. As soon as that remedy is out of the system, that drug is out of the system, symptoms return. This homeopathy is helping the body recuperate and balance itself, bringing back the homeostasis.
So you would use one of the three, not all three together?
Let's hear, what do you guys think?
Whichever one would fit best.
Okay, or a combination. You guys getting it? Good answers.
What is the second one? Is it a G?
Yes.
Glenoid, yeah.
It's not glenoid.
Yeah.
And what's special about that?
Okay, this is nitroglycerin. See, they made it. You can make a homeopathic medicine out of a drug. What do? They made a homeopathic out of it. And what does it do? Nitroglycerin is about opening up blood flow into places, right? Right? Because blood flow is closed. Here, the blood flow is probably closed to the top of the head. So all this blood is stuck in a congestive headache. So you can use glenoid as a remedy for opening up that congestion, opening it up. So it's a dramatic action on circulation. It produces flushes, palpitations, and it can, for high blood pressure and heart disease, and the person is, they feel almost like it's like they've lost, they're lost in well-known places. There's a confusion. They're maybe aggravated from the sunstroke. Feels like their head is going to burst, pulsating. It's a pulsating, bursting headache. Worse sun, hot flashes, pulsations of heat. And it feels better from if you give it some pressure or from lying down in the dark. Okay, so you can, 4 remedies. I'm going to quiz you guys at the end of this today and see if you guys can remember. But slightly different pictures. Slightly different pictures between all 4. And okay, we'll take a break, 10 minutes, and then we'll come back and I'll do the middle ground, and I'm going to test you guys a little bit and take your questions. All right, we're going to take a 10-minute break. We're taking questions, teaching. Bring your questions to the Patreon, and we'll take them there. 10-minute break.
by the store. I got a couple people talking to me. Yep. I thought last spring, choosing between two people, and then my husband retired a year ago, so.
How long have you been there for? I know I've been there.
I bought it in 2018,
Okay.
and from the original owner, I had it for 31.
Oh, wow.
Yeah, so well established.
Yeah.
I just need to be led up to this then.
If there's any questions, you can ask me. I'm here to answer your questions.
Everybody configuring, narration, things like that, and then the social media. Yeah, so now, there's a lot more younger people. Yeah, because we're in the seniors. Yeah, that would be half of our time. Every day there's someone new that comes in and says, oh,
Yeah.
so it's just makes me think they just try to go online, but no, they want to come in and see the touch.
Yeah, I think I went in there, I was looking for like a homeopathic remedy, like a long time ago, like probably maybe 2 or 3 years ago. And, cause I had always had to go to Hamilton to get some stuff, and I was like, I don't usually go to. I mean, sometimes, like Xavier usually super strict to have like a few remedies, but not what it's the
Yeah, she said to me, you can still up on our fence, and I'm like, oh, yeah.
I was trying to get her to come, and she's like, I don't know, and I'm like, you should go to the next one. So, yeah, she's
She's a smart lady.
she's very smart,
She hasn't done her profession very long, she's very good.
she's brilliant.
Just crush some of the, you really get in charge of.
All it's just fresh, like it's dried, so you might want to check it for moisture, depends on what you're using it for, right? Check it for moisture. Yeah, hang, that's just the way I do it, but I got the space for it too, so. Like your little race car? Your little-
So one was a duck and one was a chicken. Mine didn't work.
No?
But Sarah and I tried to make some.
I found it when, because, you know, it's my wife.
Yeah.
And she's like, what do you do? It's just 2 girls and sit there and race.
We didn't leave until 1 o'clock in the morning, because Sarah and I sat there for so long playing with them. We didn't even do any children's, I just went for us my like, actually put in the fire.
She's so ready to get it there.
Clean up like dishes, garbage, stuff
bad. Yeah. Yeah, no consideration whatsoever for all the other 30 people.
That's gonna be,
I know,
keep them there.
maybe she doesn't
They have
realize how
Christmas
much
party.
voice carries and
Yeah, we love the
all
crowds,
that.
okay,
As soon as I got that back, I thought, oh, geez, it'd be a waste of my time.
stuff like that, or computers.
So I went home, got on the website and filed a complaint.
Yeah, they're just, well, it's just.
I'm not getting up at 6 o'clock in the morning for the rest of my life.
You gotta.
When most people are ready to do that, that's my biggest.
Yeah, like, before, or in the evening, like, right about now, I think you have to have a lot of gender right now, I don't.
I didn't know you
Yeah, I don't-
That's the senior building, it's full of a lot
Or
of
it was taken out of that meeting.
Yeah, yeah, pretty much, yeah.
quite young.
There's a couple of people that
Just
don't
doesn't
see
seem to
what
get
you're on the orange sheet in the day.
We're all back?
That's my big one too, summertime, it's like nice. And do iced tea or lemonade, coolers also.
Yeah.
You can change it up every once in a while.
So I wrote the names of basically most of the remedies that we've learned about that are very similar or useful in some ways that I'm going to ask questions about. So let's bring it all our knowledge home. Let's bring it all together. Let's see. Yeah. And before we do that, I'm going to cover the last couple remedies in the middle. Similarly, we have another picture with a black eye. There, it's showing ledum again because of the congestion in the area that builds. Phosphorus, it's for upper body, red blood, for nosebleeds. It could be for people with a lot of.
Is that for kids that get nosebleeds all the time?
Yep.
For breeding gums?
It could be for bleeding gums, even for dental extraction and bleeding from that. And it could be even for some feeling of electrical shocks after like a dental procedure. And another thing that's good for that is hypericum. Anything that has to do with cuts and nerve type of pain and shooting pains. There's another remedy that's added with phosphorus called ferrum phos. It's iron that's added with phosphorus, and that's also it helps to stop bleeding.
What are the indications that are different between ferrum phos and phos?
Ferrum phos is actually phosphorus is a we're going to learn about it if we do this at next course. It's a very common remedy that's used for like phosphorus. Like what would you think of what is phosphorus?
Iron.
Phosphorus?
No. Oh, sorry, phosphorus.
What is phosphorus used for? Who knows? It's matches. Yeah, matches. Huh?
So.
Phosphorus. It's those red.
Phosphorus again.
Oh, okay.
So what's the energy of phosphorus?
Fire.
Yeah, it's upwards. So what kind of remedies phosphorus is used for? It's for that, bubbly girl that walks in with curly hair, upward energy, right? She's gets really tall in the class, right? It's like I've given this remedy to that very bubbly personality, upward energy, it can engage socially, is, the magnet brings everybody in, right? No, it's the phosphorus energy. It's this, it's this upward, you can use it in the hair. It's like a curly hair, right? Right? So they have certain tendencies. They'll have maybe, because of that upward energy and blood flow, very smart, quick to get things, but they may get nosebleeds. That there's blood flow going upwards. It's an upward energy movement, and it could be too much. And so when that kind of things happens, then you can use the remedy to balance things out a little bit. Everything, it should be in balance. So even a person who is bubbly and cheery and everything, which is wonderful, but there's a side of it, like not knowing what's it called, boundaries, and not knowing strangers, and right there you have to. So all of these, we the hope is to be in homeostasis, to be in a balanced state, and signs such as nosebleeds are an indication that the blood flow is not, there's something out of balance, right? And so ferrum, yeah, ferrum phos is iron. Okay, so let me tell you indications of that remedy, because iron has its own indications.
Is ferrum phos like inflammation?
It's more for there is inflammation there, but it's for fevers and flushes of heat, and right-sided complaints. It's for anemia too. It's for people who have anemia, like low iron in their blood.
Did you say right side?
Right side, they'll have a lot of right-sided complaints.
So will it help bring their iron level up then?
It could help their, yes, if this remedy that would be more for a chronic condition now. So this is now we're our indications, we're talking about acute conditions right now. For chronic conditions, if it's the right match, then yes, that remedy could help your anemia.
So are tissue salts part of homeopathy?
Yes, they are.
Okay, like we sell this in a tissue salt.
Yeah, so tissue salts are combinations such as ferrum phos, nat sulf, nat mir. All these things are different types of salts. That I think there was a philosophy that human beings have 12 main salts, and then they use them in a very light dosage, like a 6 or 3C or 6X, something like that. And they have those have similar indications using like in the homeopathic way. So it has a lot of respiratory and gastrointestinal issues, and it helps to it's good for lowering fever. I guess it has a lot to do with flushes of heat in areas. So a nosebleed that could be from that could potentially, if you don't have phosphorus, then you could use ferrum phos. And then we've covered hypericum, we've covered ruta, phosphorus, cuts, wounds, bleeding, just like calendula and hypericum. Those in their mother tinctures. Rust tox we covered. So we've basically covered all the remedies. So let's take the last little bit, and I will pretend to be a patient, and you will do a differential diagnosis. What's a differential diagnosis? Who knows what differentials are? Differential diagnosis, have you heard that term? We use it in medical school. Basically, I'm going to come up with symptoms, and you're going to shortlist what remedies it could be, figure out what the problem could be, and what would be the match. Yeah, so this is fast-paced question answer. It's an open book test. So we're all going for our juniors soccer match, and junior's been playing all day, hasn't been drinking enough water, comes back and says, I feel so tired. I just, you know, I feel I don't want to move. Can we go for a car ride and just leave the top open? And you're like, Junior, you were all energetic and you were playing. Did you drink enough water today? Sun was really hot. What's going on with Junior? Could be going on with Junior.
So some sort of like heat stroke probably.
Maybe. Okay. Go ahead and ask me some test symptoms and I'll try to.
Do they have any redness or heat in their head or their limbs?
I don't feel hot. I just want to lie down. God, I can't even speak.
You passed out?
Almost. Junior! Wake up, Junior! How come you're so tired?
So the carbo bed,
Yeah, why not belladonna?
Because that's for hot, inflamed, and like head is hot, limbs are cool. But
Yes.
that doesn't fit.
Right. Very good, yeah. That would be, you could be having a kind of a sunstroke, heat stroke symptoms, and you would use a med remedy like Carboveg, yeah. Right.
And then you wouldn't.
And so how much would you use? Let's do all of it.
Read the bottle.
Huh?
Read the bottle.
Read the bottle. Read the bottle, you said? What would have happened if I just gave the whole bottle at one shot?
We have no more for later.
Okay.
It wouldn't be more effective than just taking one at that time.
That's right.
And we want to take.
'Cause one dose.
Frequency.
Yes, it's one dose. So what there is some critics you'll see online. They've said we want to debunk homeopathy. So they broke in to a store, and they went and they opened up all their bottles and started taking all of them and say, hey, look, nothing happened to us, right? Yeah. Why? Okay, you tell us. Why did nothing happen? They try to prove a point. How does that doesn't it actually only shows in homeopathic theory that nothing would happen? Why? They took a whole entire bottles of things all at once.
They took too much.
Did they take too much?
Yeah.
They took too many things so the body didn't know where to focus the energy.
Maybe. Could be. But if they say, look, I took so much, I took the entire bottle.
So they took one dose.
They took one dose.
It's frequency, not amount.
What was that?
It's frequency, not amount.
Exactly. So it's not there. You have to learn before you want to even debunk something. Because you know what I do is, if you really want to have a friend, okay, says, oh, that homeopathy, I don't believe in it. All right. So you say, oh, okay, all right. Would you be willing to do a proving with me, right? So you give a remedy for like constipation, all right? And you say, I'm going to give you, don't tell them what it is, right? We'll give you 200C. You just take it every single day and just report back to me on what you find. Right? Within like the second day, you're like, what you doing? Right? They didn't know what you were giving them, right? Very safe little test. You have to make sure they come around there. They signed the waiver.
Blind.
Yeah.
Blind stuff.
Okay, good. So you would take. So how much would you give then of Carboveg? That would be a good dose.
probably 2 tablets, 2 or 3 tablets.
2-3 tablets of 1M.
If he was like gonna die, probably, like if it was really, really sick, not die, but like if it was more severe,
Mm.
if their symptoms were pretty,
1M. We all agree 1M.
probably 200 would be more than most, unless it, like I said, unless it was like grave. then-
Yeah, I would say don't go above 200. We are all beginners, like who are just starting with homeopathy. 30C is a good dose. 200C is a good. You would take. This is something that you would go take to the hospital, and you would take him there so that they can rehydrate him, make sure you check him out. But if you want to assist, then you're on your way, then you would just give like a 30C. You might, by the time you get to the hospital, he might be better.
So now taking you to the hospital, give me something, do I tell the doctor what it'll give me?
You know, you could, but they're literally, they're not going to care. They're gonna be like,
They didn't care
sure,
more
buddy.
if I care more if I told them I gave them an aspirin or a Tylenol.
Yeah, maybe that would, they would care. But if you told them carbo veg, actually it works because there's no molecules in it, but you know, it's, I didn't give belladonna because they were like,
During this whole term, I take you over an H now.
yeah, they won't really care. You could tell them I gave a homeopathic, but you know, it's to them, it's, there's no harm in it, and there's right, they don't have any accounting.
So it's not gonna change what they're gonna do anyways.
No way.
What's the basic amount of time before you can start, taking more?
For example, let's say you had 30 C, right? You gave it, and he says, oh yeah, I'll have some water now, right? And you see a little bit of benefit, right? You can wait till you see that benefit start waning off, or if it's an acute situation, you feel that he's better, but you want to, he's still not well, you could give another dose, but I would say maximum 3 doses in the day.
Is there like specific time limit or does it really?
You can get a 15-minute apart dose is another dose, but I usually wait a little bit before I give. Like
An hour, I was gonna.
yeah, I usually see like an hour to see how the person's doing, and if I see a little bit of benefit and no aggravation, I can give another dose. If I see an aggravation, I don't give another dose. Yeah, does that make sense? That's good. You solved that one with. Okay, let's give another one. We all went to dinner after Junior got better from the carbo veg. We saved us 11 hours at the emergency. So it's, let's go for dinner. And we all had some nice meal together, but when I came back, you know, someone in the family starts saying, oh, my stomach doesn't feel well. And you stop off once, and they have nausea, and dinner is now on the side of the road. Then you drive a little bit further, and again, you need another break, need to stop. They're having nausea. They have some food poisoning, and they're just vomiting over and over again. Everything is coming upwards. And they... Did they have fish? Sure.
Give them the same medicine you said.
Arson album?
Okay, arsenic album, okay.
Ipecac,
Okay, why arsenic album and why Ipecac?
Ipecac to stop nausea and vomiting.
Same with arson, but it also, is with anxiety as well.
This person is actually in a great mood. No problem. I just don't know why I have nausea. I must have had something bad to eat. So no anxiety, just nauseous and vomiting. They actually do vomit. And they keep on vomiting. They don't know what to do to stop the vomiting. What about Nux vomica? Would Nux vomica fit? This vomiting it just keeps on going and doesn't seem to stop. They are even after they vomit, they still don't feel better.
Is there a difference into what it's induced by?
It could be, yeah, but we're still looking to match symptoms.
Sorry, you said no anxiety?
No anxiety.
Being sick that many times would make anything anxious.
Like I just gave this remedy to my daughter because she is expecting. So, huh? Ipecac, yeah. The remedy is Ipecac, a very well-known remedy for nausea and vomiting, which actually is, very commonly used in homeopathy to help to resolve that nausea, vomiting, irritable feeling. Nux vomica is more for the liver, right? From perhaps you were going to, you had some symptoms after you took some alcohol or drugs or something. That's different organ. And arsenic album, it could be possible, but it all depends on the symptom. And arsenic album has a lot of burning sensation and a lot of anxiety associated with it. And it can also be potentially used for food poisoning too, though. But ipecac is a good remedy for nausea. And you would use again, what kind of dosage? Yeah, sure, 30C. And the whole bottle? It doesn't matter. You just a little bit. All right. And when you get home, the baby has not been sleeping. And mom's up. She's been pacing back and forth and back and forth. She's, I am exhausted. It's time for you to take the baby. And as soon as you say, all right, as soon as you sit down, baby says, get back up. Wow, wow, wow. Right? And they have huh?
Who are you treating, the kid or the mom?
Yeah, we can treat that's true.
You treat them both with chamomile?
Well, you know what? That's a very good question. Actually, if the child doesn't take remedies, which is not difficult, we'll think about how you would give these remedies. It's very similar to how would you give the child a remedy? For example, if it's
Eyedropper in the mouth.
yeah, an eyedropper, you could put the pellet in the water, and then just take a little bit of small sip of water, or put your finger in the water and but let's say the baby just doesn't want his teething, you could give it to mom, and if the mom's nursing.
I was gonna ask, does it go through the process?
Yes, it's gonna, the babies feed off a lot of how the state of the mother is.
How soon after mom ingests it, is it going through the breast milk though?
We must take a little time because breast milk is going to be produced, right? So it has to be produced from the, it would take a little bit of time. But it also means like there's a state, mom is in an irritable state, baby is in an irritable state. They both have indigestion. Baby might be really worse, because a lot of times, children also have indigestion and food and allergies because the mom is eating something that's not sitting well with her. So now baby's having indigestion because mom is actually eating foods that are not really suited for the babies. They're just sensitive to it. So we oftentimes treat this like there's an ongoing case going on where mom and baby are bloated or irritable or not having good stool or not you're cranky. So you can give it to both, and it'll pass through and it'll last longer.
We sell this it's a liquid, it's a squeeze thing.
Oh, okay, yeah, that's nice.
So
Chamomile.
It's
Yeah.
in the baby's mouth, and I think the box says you can do it again in 15 minutes.
Oh, okay, yeah.
And I think it's like 3 times so that it's getting.
But if as a right dose, I'm telling you, I've seen these remedies. One dose from hours of walking, and suddenly like one dose within like 5 minutes, baby's asleep. It's that. So, I only wish people knew more about this homeopathy. It's that incredible.
Yeah, we used to tell my grandkids.
Yeah. Okay, so let's say I got a cut. I in the tool shed looking for something, and I stepped on a nail and went in deep and pulled it out, and now I'm having sharp pains. Shooting pains. Oh, I stepped in this nail, and every time I put my even foot down a little bit, I'm getting this like shooting pain all the way up the leg. It's like a nerve pain, all the way right to the back. It would be
Lydium for the function wound.
okay.
I've heard hypericum for the nerve pain.
Okay, so we have ledum, we have hypericum. And my leg is, and I have, what's it called? Let's say, yeah, it's swollen as well. It's really swollen, and it's, you know, it's like burning. It's a burning sensation. Okay. What kind of remedy? Or should we combine some remedies? What would be your combination? Yeah. So what would would calendula be in a remedy form or in the mother tincture?
Looks like a remedy. No, maybe not, yeah.
Cantharis would be good for the burning.
Okay. Yeah. So all good. You guys are all now on the right track. So you see, now you have to see what the major symptom is. If they say the main thing is the shooting pain, that's the main thing. They're looking at hypericum. If the main thing is a swelling and congestion in the area, then you're looking at ledum. If burning is the main sensation, right, then maybe cantharis or arsenicum or even if it's like you know, belladonna it could happen if now you're even getting a fever because of it. And if you're getting a fever, if you get symptoms, not full symptoms, you should actually go to the hospital, right? But you could try one of these remedies, or you could try all of them together. It's not bad. It's a combination, and you're trying to just heal up quickly. You could even use the mother tincture if you had calendula and you rub it on the area with the original substance, right? You could make a cream out of it, or just put drops through from the tincture itself.
So when on here, it's got the symbol for mother tincture. Does that mean you can use it topically? In that
That's
case?
right, topically. That's right.
Okay, so that's what it refers to. Okay.
I see a cigarette in this picture, what, does that anything to do with this?
What was that?
I see a cigarette, a smoke on the plate,
On the plate?
right here. Is that not? a
Oh,
cigarette?
yes. That's probably talking about. That's the exhausted mom. She's addicted to cigarettes because she's so exhausted. I think it's a picture showing. Yeah, that remedy would be for the mom who needs nux vomica. She's using substances now. She's abusing substances.
So that's a bottle of wine, not a bottle of bus.
Yeah.
Maybe.
Put all the sins in there.
Okay, let's give one more patient. So you take, while you're, you wake up in the morning and, okay, so you had a rough day at work previously, or you were going through, you're moving boxes, and you're helping someone in the family do some moving, and you wake up in the morning, you're all sore, and but after you move around a little bit, it feels a bit better, and you put a little bit of something warm on it, and you can move it all just fine, but then you sit for a little bit longer and you get up and you're back to that rusty hinge feeling. Would you take, huh? Okay, we have Ruda, Rustox. Why not Arnica? Should be Arnica or Rustox or Ruda? What do you guys think?
Rustox is for old symptoms.
It's for muscle indigestion.
So when you, here I just said the deciding factor. When you put warm on it, it feels better. Is that an Arnica symptom or a Rustox symptom?
Arnica feels better with cold.
Yes. See, that's how you distinguish the remedies. If you take arnica, it wouldn't work. You wouldn't have get the results you would take from rest talks. Because after your lifting boxes, you got you sore, but it's not a soreness that's happening because of your like a bruise or a trauma. It was probably from overuse. Now if it's the connective tissue, then Ruta would help. But if Ruta is more for the smaller joints, here in the wrist, the eyes, and the ankle. This is a lower back, so your back is hurting because of the boxes you have here.
And would you say works better with warm?
Rust talks.
Okay.
When you add warm, then you're feeling it's better.
Once if you took, let's say you're trying to medicate yourself and you took some Ruta and then it wasn't working, so you're, oh shoot, I need to take that rest tox instead. You said you're not supposed to combine stuff, but could you take half an hour later, take the other one?
You could, yes. That's right. That'd be a good try. Yeah. All right. So that's I think you guys got a little bit of hang of mother tinctures, of homeopathic remedies, how to distinguish remedies, how we got a little bit of philosophy in there. Do you guys have any questions about homeopathy? How to use these? If you really want to get into this further, then I would recommend getting a book on Materia Medica. Or you could get just even, now there's, honest speaking, there's even apps you can go on to look for, like homeopathic app, right? And you punch in your symptoms and it'll shortlist some remedies. And if it's more heat, better from heat, then consider these remedies. If it's better by cold, consider these remedies. If it's on the left side, consider these remedies. And then you can look at each of the remedies and see further from there. And I would suggest just playing around, trying it.
I looked online at the books, my bookmark, let's say it was $100 for the desktop, keynotes.
Oh yeah.
But they also have quick reference cards for $10.
Okay.
I'm not sure who buy what or whatever, but they're just quick references that will get you started.
Yeah, sure.
Your computer full, whatever, you can
Yeah,
go out
yeah,
elsewhere.
yeah.
But it'd be a cheap starting point, I think.
I think even cheaper is going to be an app.
Yeah.
I just typed in a couple words and it brought up a whole plethora of information.
Yeah, oh yeah.
Those
Lots
two
of information out
words,
there.
just-
Thing is, as beginners, you're going to be confused if you don't follow the patterns that I'm telling you.
Okay.
Right? The way you do this is just, now you understand kind of dosages, frequencies, the model of how to use it, and this, the like cures like. So you're gonna look at the symptoms picture in general and see the main kind of moving force, okay? So the main thing is anxiety, the main thing is being one left alone, the main thing is aversion to heat, main thing is sharp electrical sensations, you look at that main thing, that main indicative, right, that's causing and then you take your remedy from that symptom in the acute picture.
I found it helpful to learn that arnica works better for cold,
Yes.
and, the other. works
Rust
better
talks?
for warm.
Yep, but what they're doing,
That was.
for
the
example,
connection, right?
that's right. But they're slightly different also, that arnica is more for, it was more for like a bruised thing that happened after, the rust talks could also happen because of overuse, but it's kind of connected to the tissues and joints, whereas
Don't they
arnica,
both have congestion?
what was that?
Don't they both have congestion?
Arnica is more for there's athletes, if they run around and they burnt their they had it was they got a burn, a lactic acid burn, right? Then there's sore muscles after that, or there's an injury, so is more for the arnica state. The rust talk state is more that you could have been done the activity, but it's not you didn't, it wasn't like this lactic acid buildup, it just caused some type of a strain or
It's
something
an
that,
old strain.
it could be old, yeah, but it doesn't have to be old, you know, you could just be tired from the next day because of lifting boxes too. But it wasn't an injury, it was more like you got, um, pain from it that's causing you to be like a, you know, like a rusty old hinge, and now you're like, if you move it around, you're feeling better.
Does one have inflammation or can they both be?
Well, they're both, there's both a different, just different type of inflammation.
Yeah.
Yeah.
I hadn't really thought about the cold after this one.
Yes, that's one of the symptoms for arnica.
So
Yep.
for, bee stings,
Mm-hmm.
Apis,
Apis.
Apis,
Mm-hmm.
so now that's just the sting itself. So then if you had the stinger still stuck in you, or no, I'm sorry, if you were deadly allergic to it. like,
Yep.
you know, there's the needles and stuff like that, what would you take to that?
Well, you have, if you're anaphylactic, you have to take you have to do everything that regular. This is, I'm not telling you to take this as an alternative to regular medical stuff. I'm just saying that these are things that can help.
Right.
And some things are not emergencies. They could be acute, but they're not emergencies. A person, you know, who didn't drink enough water, doesn't have his sunstroke, he just has a headache, right? They're feeling tired. You could use, like, you know, depending on the symptoms, glenoid and belladonna or something. And it's not a hospital stay but condition, but instead of using medicine like Tylenol, if you even just using Tylenol over and over again, it has an accumulative effect on the liver. It hasn't. You don't want those things. I try to avoid as much as I can, and so the body becomes a lot more resilient and stronger in general. Like one of the key predictors of a recurrent of a future ear infection in a child is a past use of antibiotics. So though you have to break that cycle, right? You're having ear infections over and over again. So if you can give a chamomile remedy, and you able to get over the ear infection, you don't give an antibiotic, then now you're preventing a future ear infection. You understand? They're so profound, the benefits of this. Yeah. So rust talk has it's like a progressive problem that happens from overuse. Ruta is more for the ligaments, and arnica is more for like an injury. All right. Hope you guys enjoyed that, and so we're back on next week, I think, anyways, right?
No, this is our last night.
I mean, but for the next, if you guys are interested in like the supplements and course on, we're gonna be. I think we're on next week. I think.
Starts next week already?
I'm not sure actually. I think it is. I'll have to check.
Canada Day is next Wednesday,
Yes, it's the following week.
so must be the following.
Oh, okay. Next Wednesday is.
It's Canada Day,
Canada Day.
Oh, okay.
so it can't be then.
Oh, okay. Oh, good. Good. Okay. Any questions from you guys? No? And we'll see you guys, whoever we do see. We'll see you guys next class. If not, then it was a pleasure. Thank you.
Thank you.
Yeah,
Thank you very
it
much.
was nice to get to know you guys.
Very interesting.